designed this class because I was learning from Dr. Tan for so long, for more than 20 years. And I see him with all these different basic things to start. And he has that core foundation. And then I was thinking core foundation has too much information for people to absorb. Then I was looking at all his courses and all his modules. And then I decided I make it to 3 different modules. So module 1 is the foundation of Dr. Tan's balance method. We always say acupuncture 1, 2, 3, 1, 2, 3, 1, 2, 3. First of all, Dr. Tan will show you what is 1, 2, 3. And then in my course, I will teach you what is step number 1. You will need to learn meridians. If you're an acupuncturist, you got to know meridians because that's how you identify where the points on the meridians, correct? So that is the module 1. The step 1 is the most important one. And then the second step is the systems. So Dr. Tan gave us 5 systems plus 1. He never really specified the system number 6, but we will be okay. I'm going to explain to you more during the class. But you're going to use the 5 system to pick the meridian, which can balance the 6 meridian. And step 3 is the most magical part because you're going to learn the imaging and mirror to pick the points from this whole so many points on the meridians. Be able to precisely helping your patient with their illness by using the mirror and imaging method. So you will be able to treat any problems on the body from the head to the toe. Every single thing that you can think of, as long as you can identify the meridians, you have 5 systems to balance it. Once you have that in you, and it was really robust idea, how to use them, how to utilize imaging and mirror, eventually, then you will be very strong on your basis. We might leave the points, but we stay on the meridians. And that can absolutely right away can diminish the problem in no time. Dr. Tan always says 6 seconds. So that is the very important one for you to be able to learn mirror and imaging. That is a system. The foundation of Dr. Tan's balance method. You got to have that learning. So module 1 are so important for you. So please take the classes at least 1 or 2 or 3 times. You get so familiar with it. And then you'll be able to choose. It's from the hand, it's from the foot, it's from the head, it's from where to treat what. So that is the most important part is imaging and mirror. Help you to decide what point you're going to use. So that is the module 1. After module 1 and module 2 is giving you more information to choose the patterns, to treat the pattern problems. Because of using the Pa Gua and I Ching, so you'll be able to utilize the Pa Gua and I Ching, pick the best point suitable for that pattern. Once you use that, then you put 2 needles in. And then you, per meridian that you choose or the pattern that you choose, then you'll be able to change the complete environment of the sick environment to non-sick environment. So the body has to change. You have to follow your instruction, your guide, to be able to changing the situation that your body is in. Then your illness is gone or diminished. Maybe you need more treatments to be able to get better. So now become a question that all of you have. Is what? How long, how many treatment do I need to treat like headache, right? To treat menstruation cramp, to treat liver problem, right? To treat kidney problem. Because we are not specialists in this area, but we treat it. Right? Because we see the thing as a whole. And then you lack of experience of treating one specific thing because you're not from the kidney department of the Western medicine, right? So you don't train on that. So you don't have that experience. That's why you feel shaky sometimes. But as long as you trust the pattern, as I explained to you, you can treat kidney problems. Use the Pa Gua to pick the points. And then you see the results. Because you're treating a person who is alive. It's not a dead body. We are not just taking a kidney out, like, how do we get rid of this kidney stone in there? Or how do we increase the function in there? No, you don't do that because we treat the whole body. Once the body is continue healing, and then your whole five organs, Teh-Fu, they will increase their power. Then the illness is gone or diminished. So when that pattern is given to you, it's already been using it for hundreds and hundreds and hundreds of years. Just apply it and see the results. Then under the module 3 is all our advanced track. If you don't have the first 2 modules, don't take module 3. It's going to confuse you so much. Because module 1 and 2 is the most basic work that we have to do to learn Dr. Tan's balance method. It's like operations system. Like you have an Apple phone or you have a Windows, then you have to have an operating system. Those are the system has to be in place. Then you'll be able to add more app on it, right? You just download an app. I am giving you the app in the advanced track to be able just to download in your head. Now I know how to treat it with a seasonal problem, with somebody was so depleted that you need to tonify this person. Then you can choose the 5 element, balancing the 5 element. And then if somebody is so excessive, then you want to decrease that excessiveness. Then you use balance the 5 element. We have a seasonal balance. We have Dr. Tan's 5 element balancing. And those are the courses for you to learn how to treat the points with different situations. So it is not anything extra from the module 2, but you'll be able to pick a much more effective combination of the points by using the 八卦位, I Ching 八卦位, to give you an idea and then touches about how the Chinese medicine evolving from just treating the pain, treating the local problem, and eventually the systematic problem that you can use the pattern plus magical points, right? Where that magical points from is translating, converted from the I Ching 八卦. So that's why they're in module 3. But if you don't have module 1, the basic operating system, and you don't have the app to compose this together, module 3 is not going to help you a lot. So you have to have very strong basic, and then you have to learn what is the acupuncture 1, 2, 3. If you don't know where the problem is, you're just closing your eyes and throwing the dots in the air. That is not how we do acupuncture. This is very important. So when you learn this, you got to learn it from the module 1, because the module 1 teach you how to translate all this Western diagnosis that hold the world. All your patient comes in, they just tell you they have those Western diagnoses. How did you translate it into our acupuncture 1? The step 1 is the most important. You need to learn how to translate that. Come to my course for module 1 that will help you to identify those problems. And then going on to module 2 and module 3. So please remember, you got to have a robust operating system. That's the module 1. Then module 2 is all the app, put it in there, make you even stronger. Then you learn how to pick the magical point via 八卦I Ching. You have no idea how magical that is for Dr. Tan's 12 magical combination. He called it a strategy, not just 12 points. Everybody can pick 12 points anywhere from the thin air. But how did you place that 12 points in such a magical way that you'll be able to treat patients with that 12 points? If you are very solid on the module 1, especially the mirror and imaging. Remember, that is a number 1 system that you learn how to pick the points. You got to learn that. And then you have to break them in apart. And then you have to put them back together. That's how magical that is. So Dr. Tan's story about the 12 magical points is he is always having so many people come in with like 20, 30 different symptoms. It is like, I need something to be able to treat so many problems at one time. That's That totally makes sense. If you are a practitioner, you practice for 20, 30 years later, you'll be like, God, why people treat themselves so badly? They injure themselves so badly. Then they come to see me that I have to fix so many conditions, right? Then he's keep on thinking. So one day he was telling me, you know, after the creation of 12 magical points, the strategy of the 12 magical points, I think I am really thoroughly understand what acupuncture is all about. He said, I already finished playing with acupuncture because I think I got it all. And then he launched that 12 magical point, the strategy book, the Dr. Tan's strategy of 12 magical point, that book. He trying to explain to people, it's such a simple concept. And then he practiced in his clinic for so long. And he know this is robust strategy. Then he tell the public, he is giving himself that it's time that you did all you have to do to make the acupuncture into another level, up to another level. So when he started teaching with such enthusiastic, but some of the student was not learning the imaging and mirror good enough, familiar enough, so sometimes they stuck. So people does not give a lot of credit for Dr. Tan's 12 magical points, the strategy. Anyway, so if you really want to really good at that 12 magical points, then I would really, really recommend you has to have module 1 at least 3 times. And always practice imaging and mirror to a level that you don't have to think, what do I do? Which part that I need to use to imaging and mirror? Then you'll be able to really utilize the strategy. And I will be very happy to join you because that is such a flexible system. Dr. Tan's 12 magical points, the strategy of the 12 magical. He always said it's strategy, it's a strategy. So we will be able to do more about it because the simplest the things, the most profound information you can learn from most simple things. So that is the magical of the strategy of Dr. Tan's 12 magical points. And hopefully I will see you in the class. And it's such a fun strategy, and then you can see all answers. There's only one pattern. There are so many patterns can treat the same thing in that the strategy of 12 magical points. That is one of the things Dr. has been doing since the day one that he has that balance method acupuncture. He used to have a forum on his website. People can ask questions. People can support each other. People can talk about Dr. Tan's balance method in the way that people be respectful and asking questions in the Dr. Tan's balance method way. What does that mean? People will ask questions like acupuncture 1, 2, 3. So you got to know what is a sick problem or what is the problem, and then that's step 1, 2, how to balance it or what pattern we should use, and number 3, what is the point. So we have 2 ways of doing that to support you to be part of our Dr. Tan's balance method community. And we have number 1, if you did take any of Dr. Tan's courses or my course, then you will be assigned to a Telegram group. Then you can ask questions daily. And many people who are a senior practitioner for Dr. Tan's balance method, they'll come up to answer your questions. And some of the questions are, if you ask the too vague of a questions, nobody will talk to you. Why? Because you didn't follow 1, 2, 3. So once you're in the group, you ask the question, what's the step 1? What's step 2? What did you do? What have the result was? And then what did you have done? And then if any of this is left unanswered, I will be answering all this question on AcuTalk. So the AcuTalk is every 2 weeks, 2 times a month, the second week and the fourth week, Wednesday. I will be answering all your questions online, 1 hour live. Then you can ask questions on Telegram group and I'll be answered in the AcuTalk. It's not free. The first one is free. Take a look if you like it. And then if you like it, you have to register for the future courses of the AcuTalk. That's the only time you'll be able to see me in live. All courses are recorded, so if you're having any questions, please go into the group and asking the questions. Then I'll be happy to answer at the AcuTalk. All right? If you're new students, you still have to take my courses in order to go into the group. Okay? And then you'll be able to get all this support, because I believe Dr. Tan is the only person in the balance method has this support group. And then please utilize your resources, and I will see you there. Bye-bye.